Welcome to the Explainer. So let's talk about that nagging pain in the front of your knee. Yeah, the one everybody calls runner's knee. Maybe you've even been to the doctor, gotten an MRI, and they point to some beat-up cartilage, and you think, okay, case closed, right? Well, what if that's not the whole story? Not even close.
And look, this is not some rare, obscure problem. We're talking about anterior knee pain that hits up to a quarter of the entire population. I mean, think about that. That is a huge reason people miss work, have to stop playing sports they love, and just live with this constant nagging frustration.
You know, for years, decades really, the finger has been pointed at one thing, that damaged cartilage right behind your kneecap. But what we're going to uncover today is that the evidence, well, it points to a completely different culprit. It's a twist that basically turns what most of us think we know completely on its head.
All right, so let's start our investigation. Who's the prime suspect in this whole medical mystery? It's a condition with a fancy name, chondromalacia patella.
Okay, so what is that? It's basically the technical doctor speak for what's showing up on your MRI. It's when that smooth, glassy cartilage on the back of your kneecap starts to get soft and break down. And yeah, it looks bad, it sounds pretty bad, and it seems like the obvious reason you're in pain.
But hold on. This right here, this is our first major clue. We have to draw a really clear line in the sand. The pain you feel, that's anterior knee pain, or AKP. That's a symptom. The cartilage damage they see, the chondromalacia, or CP, that's just an anatomical finding. They are not the same thing. And confusing the two, well, that's where this whole mystery really starts.
And hey, it's an easy mistake to make. I mean, get this. Over half of all people with this kind of knee pain also have these cartilage issues show up on an MRI. So you see that connection, and of course you're going to think one causes the other. It's no wonder we've been blaming the cartilage for so long.
But just when you think you've got the bad guy cornered, there's a plot twist. A single, absolutely critical piece of evidence comes out and it changes the entire game.
Okay, look at this. We're looking inside a knee right now with a tiny camera, and you can see it plain as day, a fissure, a crack in that smooth cartilage. I mean, that looks like it would hurt, right? It has to be painful, doesn't it?
Well, here it is, the big twist. Cartilage is aneural. Aneural means it has zero nerves, none. Just like your hair or your fingernails. You can cut them, they don't hurt, right? Same deal. It means the cartilage physically cannot, send a pain signal to your brain. So no matter how shredded it looks on that scan, the cartilage itself is not what's hurting you.
So, that just blows the whole case wide open, doesn't it? It leads us to the real question. If the cartilage can't feel pain, what can?
Okay, so this is where we start uncovering the real culprits. It turns out the cartilage damage isn't the root cause of your pain. It's actually just another symptom of a much deeper underlying problem.
So where's the pain really coming from? It's coming from all the other stuff in your knee that does have nerves. We're talking about inflammation in the joint lining. We're talking about increased pressure in the bone that's underneath the cartilage, or the little fat pad in your knee getting pinched. It's all those sensitive tissues that are getting irritated and screaming for your attention. So what's bugging all those tissues? The real culprit, in most cases, is a subtle little mechanical issue called patellar maltracking. And that's really a tracking problem.
The easiest way to think about this is like a train on a track. Your kneecap, your patella, is the train, and there's a groove in your thigh bone that's the track. Now in a healthy knee, that train runs perfectly down the middle. But look at the other image. The train is shifted. It's running on the edge of the track. That's maltracking. And that little shift, it creates all this extra pressure and stress on one side. It irritates all those tissues we just talked about. And you guessed it, over time it's what wears down the cartilage.
And here's a key point. That train doesn't just jump the track for no reason. It gets pulled off course by other issues. We're talking about muscle weakness in your legs, or even imbalances way up in your hips and your core. So you see, it's not just a knee problem. It's really a whole lower body problem. All right, so the verdict? That chondromalacia they see on your MRI, it's a finding, yeah, but it's not the root cause. It's a symptom, just like the pain is. And realizing that, well, it completely changes the path forward to actually getting better. So, how do we fix this? The approach has to be a step-by-step process. And step one, the foundation, is non-operative care. We're talking physical therapy. And the goal isn't to magically regrow cartilage, it's to fix the tracking problem that's causing all the trouble in the first place. This means therapy is all about correcting that maltracking.
You're going to be strengthening the muscles that keep the kneecap centered. You're going to work on your hip and core stability to control your whole leg. It's all about getting that train back in the middle of the track and making the whole system stronger so it stays there.
And what about surgery? Look, that should be an absolute last resort. We're talking only for very specific cases where there's a clear structural problem that a surgeon can actually fix. Because listen to this quote from a top knee expert, Dr. John Fulkerson. There is no patellofemoral problem that cannot potentially be made worse with improper surgery.
Wow.
Basically, if you rush into surgery without fixing the underlying tracking problem, you can easily make things way, way worse.
So, this leaves us with the big question you have to ask yourself. Is your knee pain really a cartilage problem, or is it a tracking problem? Because that damaged cartilage, while it's real, might just be a red herring. The real culprit is almost always the mechanics, how your knee moves, and understanding that difference. Well, that's the most important first step you can take toward finally finding some real relief.